So, Rick Desai, I'm a healthcare industry consultant. I've been in the healthcare and the managed care space for, almost 25 years now, working on both the payer and the provider side of the delivery model. I've come up primarily working in kind of what's known as the network management and contracting and reimbursement function. So developing and implementing provider and payer contracts, alignment strategies, product development, benefit design, things of that nature. Working in senior level roles, VP, senior VP, C-suite level. So on the provider side, I've worked for large national health systems and integrated delivery networks like Tenet Healthcare, Dignity Health, which is now Common Spirit. I was the Chief Strategy Managed Care Officer for USCCAC Health System, a similar role for Kindred Healthcare nationally, managing about $5 billion in revenue there. And then similarly on the payer side, worked for various different health plans. Most recently, I was with WellCare Health Plans. Originally joined there as their Senior Vice President of Network Management and Strategy. And then eventually I transitioned into the role as their Market President and COO for their California market. So in that role, I had oversight of the P&L and the ops for the market, as well as some larger enterprise-wide initiatives for the company. And then about 6 or 7 years ago, I transitioned into and made the leap to opening my own consulting practice. And so that was a big paradigm shift, and I'd been thinking about that for many years and making that leap, but it just wasn't the right time and so forth. But a lot of the stakeholders that I work with asked me, about, the idea of doing this and partnering with them and kind of making that transition. So at the time, I thought it was the right time to do that and have not looked back. So 6 or 7 years now going, the name of my company is called Artifact Strategies. Artifacts is a Greek Roman background for master of trade. And it's also kind of a dual meaning because Artie, the part of the first name, is my daughter's middle name. So, it worked out really nicely there. But today I work with numerous health plans, so managed care companies, health systems. I do a lot of work with private equity firms on mergers and acquisitions and other due diligence around the healthcare space. I sit on different boards. I work with different self-insured employer groups and stakeholders, new startup companies, et cetera, and helping them to transition into the space and develop and grow and expand their solutions and platforms. So it's a very kind of expansive, eclectic, role that I play in my consultancy today. A little bit of an interesting story there. So I originally went to school as a science major. So I actually had a scholarship from the NIH to do biomedical research here on campus at Cal State Long Beach. So I was a microbiology and biochem major. And that's how I put myself through school with the intent of going to medical school in the clinical route. But kind of midway through that experience, I'm not sure exactly if it was one moment in time or just a combination of different things, but I made the decision that it wasn't something clinically in regards to practicing medicine. It's something that I wanted to do for the rest of my career. And at the same time, I was getting involved in a lot of leadership kind of roles with student organizations and other activities here on campus, which I really enjoyed. And so as I got more and more involved in there, I said to myself, I really like this aspect, right? Working in a dynamic where I get to work with people, build things, really develop relationships, and, kind of work in that type of environment. But part of me still loved the healthcare application, right? And the idea of being involved in the healthcare space and the ecosystem and helping individuals and being a part of that in some fashion. So, I made a deal with my parents that, hey, if I got into med school, right, it's my choice if I wanted to go or not. And they said, okay, that's fair. So I went through the route. I still got in. But at the same time, I was taking a lot of business courses, too, that were outside of my major. And so along that path, it evolved. I did some research, and I came across healthcare management, which was, to me, a perfect scenario because it really blended the applications of communications, business, and other things, and leadership and organizational management that I enjoyed, and then the healthcare applications together, right, in a consolidated kind of approach. So that was kind of the beginning of my journey in healthcare, and during the end of my undergraduate, I met with Hal Hunter, who used to be the, the department chair for a very long time. Sat down with him and had some great conversations about my intent, my career path, options, etc. And he gave me some great guidance around that. And so I decided to then transition into, when I graduated, into the master's program here in healthcare administration. And I applied and received a fellowship at the local Long Beach Health Department here. And that was my first entry into healthcare. And I did that for about a year. And the great experience, loved it. But the best thing that I learned from that experience was that I can never work in the public sector, right? And the pace and the dynamics and the bureaucracy, it just wasn't for me. And that's the beauty, right, of being involved in those types of experiences, is not only do you get to find out what you like, but probably more importantly, what you don't want to do and what you don't like. And that's the advice I always give my students and other folks, right, that I mentor and work with, and they ask me these questions, is, how did you kind of navigate through that algorithm, right, of deciding what to do? Because healthcare has, unlike other industries, right, there's so many different applications, right, that you can kind of be involved in clinically and non-clinically. So that first step, I knew I wanted to be in healthcare management, and then deciding from there what I wanted to do. So after I finished my my fellowship at the health department, while I was doing my graduate work, I did an internship at a local insurance company. It's a mixed model health plan called Universal Care. And I did an internship there for a few weeks, and then they offered me a position as a contracting specialist. And to me, it was the greatest thing ever, right? Because contracting was this combination of business development, it was finance and analytics, which I enjoyed. It was kind of the legal applications. And it was just like this blend of all of these components that I really, enjoyed and that I thought had a strong skill set in. And so that's where my journey started and kind of evolved from there. I'm a big advocate of really developing a strong relationship with your professors. These individuals have just a wealth of knowledge when it comes to, the overall industry, right, current and future trends, and can really give them a lot of guidance and advice. Now, some professors are obviously going to be a little bit more engaging than others. There's a mixed bag, right? But like I always tell my kids, right, you can't get a hit if you don't go up to bat. So you got to try to make an effort in going up to that and developing and engaging those relationships. And take advantage of the other resources on campus too, right, in regards to career development. Use Dr. Earliana and the department. They have a lot of guidance. And then the department also offers mentorships, right, to students that are going through the program today. So see if you can participate in that, really kind of connect yourself with one or more individuals in the industry today who can also provide that supplemental guidance. But I think that is probably kind of low-hanging fruit, in my opinion, if they can take advantage of that from a networking, communication, relationship development application. Healthcare is, as large as it may seem, right, the ecosystem, it's a very small community. And I always tell folks, you take the normal 6 degrees of separation down to 1 to 2 in healthcare, right? Everyone kind of knows each other, so to speak. So developing that network early on, really getting a chance to talk to folks is I think, critical. And then try to do as many of these like internships, programs, apprenticeships, whatever you want to call them, right, as possible. Just like my example that I alluded to earlier, right, is that it was invaluable for me with going through that process, because not only would I was able to find out what I liked and enjoyed, but again, more importantly, the things that I can cross off my list, right, that I don't enjoy, because there's so many different options there. So I would say those are probably items that I highly encourage them to do. And then on-campus activities, the alumni programs and other things, right, that are available to them, take advantage of those resources. And don't think about you have to wait till you graduate to do that. You should start doing that now, right, as a student. Most of our students on the graduate level are already, in some actively working full-time or part-time jobs, and then even some of the undergraduate students, right, to a certain extent. So you shouldn't wait, right, until you feel like, hey, I've got all of this, my degree and so forth, to start doing that. Start now, start early, and start developing that network, because that'll be an important linchpin to, being able to open doors for you and opportunities. Yeah, that's kind of the $1 million question, right? When you look at the historical kind of dynamics of healthcare. Now, when you go back, to the inception of managed care and healthcare, right, it was really designed to deliver access, right, to care in an appropriate manner. Healthcare is very complex because there's so many different stakeholders, right, in the process. You've got your insurance companies and your health plans, you've got your hospitals and health systems, you have physician groups and entities, you have ancillary providers, medical device companies, all these different kind of players. And it's a very fluid dynamic. The hardest part in healthcare historically has been how do we align incentives, right, amongst these stakeholders to drive those main, what we call KPIs, right, key performance indicators, both clinically and financially. How do we reduce cost of care? How do we improve quality? How do we improve access? So I think healthcare has really evolved significantly in the last 10 to 5 years, and the biggest linchpin and tailwind to that has been technology. When you look at the overall evolution of the role that data plays in how healthcare is managed, right? Data is the key linchpin to everything that we do and how we manage care today. Without data, it is extremely difficult, right, for any healthcare stakeholder to be able to operate, right, in a successful, efficient manner. And from a technology perspective, we're moving in this kind of next phase evolution, right, towards digital therapeutics. So, telehealth, using remote patient monitoring, using other forms of, digital interventions to really track, manage care in a more concise manner. And all of that starts with data. So I'm involved now with, a lot of my clients, right, that are outsourcing a lot of these solutions because they don't have the wherewithal and the expertise to manage those functions in today's complex environment. So as you have the evolution of value-based care, right, and performance, pay for performance and quality, and helping to align those incentives that I alluded to earlier, that has resulted in higher forms of complexity in tracking and managing metrics and really developing the infrastructure and the framework to be able to track, right, and manage that. So, outsourced solutions are becoming kind of the main conduit for whether you're a health plan or a healthcare delivery system or other stakeholders to use that to, be current and even prospectively, right, forward-facing in how you manage care today. So solutions like population health management, predictive analytics, AI and machine learning, patient engagement, payment integrity, those are just a small handful of different solutions, right, that we're looking at that's going to help to really intervene. And point solutions, right, focusing on digital therapeutics with chronic condition management like CKD, diabetes, COPD, MSK. Those are just a small handful of items and conditions that are being addressed today. But I think that's the biggest paradigm shift and evolution is the advent and the importance of technology and data that plays in how healthcare is managed today. And then also the paradigm shift from unit cost to total cost of care, right? And how payers and providers look at that, the importance of quality, the importance of patient engagement, because we know patients that are involved in their care have better outcomes and overall performance and quality. So all of those, right, those are the global macro level KPIs. And then we've tried to figure out how does technology position us to be able to address those more effectively and more efficiently.